Hi, my name is Dr. Tim Liddy from Liddy Podiatry, and I'd like to present this case where we took a toe that was deviated to the lateral position. What I'd like to show you is the post-op position of the toe now. Try to move back away from the field just a little bit there, please, so you don't touch anything. Shoot it straight down from this direction. The toe is perfectly straight now. The length is really nice, a little bit short, but we removed some bone, so that's to be expected. The toe will lengthen a little bit when I remove the pin. The pin's holding it very compressed. What we've allowed for is correction of a congenital deformity with the toe deviated into a varus position. That varus position has created a scenario of pain and deformity for this patient for a number of years. She's elected to have this surgical procedure performed today where we can straighten the toe, remove some bone, and then provide a better fit in shoes, higher level of activity, and a life of fulfillment and enjoyment. This patient had bilateral varus rotations that created pain and, of course, the deformity. This has caused her trouble both cosmetically and in shoes, pain, difficulty, and fit with a lot of her shoes. Over the years, she's lived with this. She's presented to my office a couple times over the last couple of years. We've tried conservative straightening, splinting type measures, which provided absolutely no relief. At this juncture, we decided to pursue the surgical correction. And what you can see compared to the preoperative pictures is a perfectly straight second digit. The K-wire will hold it in place for a period of 3 weeks. We'll remove the K-wire. Additionally, we'll do some suture retention on the lateral aspect here where the wound is still open. We'll close that defect, and then such will prevent the toe from moving back into its varus location. We've released all of the soft tissue structures on the medial side intraoperatively, and that'll allow for that just to scar in by secondary intention. This completes this post-operative evaluation intraoperatively as well. Thank you so much for watching. See you soon. Hi, I'm Dr. Tim Liddy for Liddy Podiatry and Prevention. Today we have a wonderful patient in, one of my good friends as well as my patient, who we have done surgery on recently. And how long ago did we do the surgery?
4 months.
4 months ago. And today is the first time that I have seen her wearing her floppy little sandals, her flip-flops.
In public.
In public. And she just shared with me a story about walking up her street. And tell me your story one more time, just for the camera.
Yeah, so earlier I had some meetings, for work, and I had nice, fancy, closed-toed shoes on. When I get home, I like to be comfortable, so I put on my flip-flops right away. And before coming here, I put them on, I'm walking my dog up my street, and I'm running into a few people I know, neighbors, and some people I don't know, and immediately I'm talking to them, and I'm thinking in my head, don't look at my feet, don't look at my feet. And I'm like, wait a minute. Yes, do it. Look at my feet. I'm so used to watching, eyes look down mid-conversation, and I'm like, what are they thinking?
So briefly explain to our viewing audience of millions of people, why did you not want people looking at your feet before?
So I was born with crooked toes, like my second toe next to the big one curved in like this. So it was always something that I was really self-conscious about, growing up, being young, and even to this day, up until surgery. I did not know that this
Even
was
recently talking to the person, you forgot that your toes were looking
I
pretty
forgot,
now.
because I'm not used to wearing open-toe shoes.
And then just zoom down on her toes and just stand there for a moment. And you really can't see anything, I think, positive or negative regarding her toes. However, we are going to put up the pre-op and post-op images, and we'll superimpose those into this conversation so people can really see what you're dealing with. Everybody has their own body morphology impressions of themselves, and we're walking around with some insecurities, and maybe some people are feeling good about themselves, right? But plastic surgery, reconstructive surgery, certainly in this example, toe shortening, or changing the alignment so that the person feels better about themselves is becoming more and more imperative in today's modern Instagram world. And I really appreciate you taking your time and
Yeah,
sharing that
thank
story with us.
you.
And I'm glad you're so happy.
And thank you for
yeah.
fixing my toes.
That's
you know?
the best part. Excellent. Thank you, Erin.